There is a difference, of course, between somebody that has had an incident that may have occurred, like a car accident, as you mentioned, and then just maintenance.
Right.
In terms of, and I'm also thinking in terms of not just the everyday patient like myself or anyone else for that matter, but also what about the benefits for our student athletes? You know, here we are, we're in Egg Harbor Township School District, and I'm saying to myself, you know, our athletes and even other performers, whether students that are in fine and performing arts. I'm thinking of the pressures that a marching band would face while on the field. Participating in a drama production. It takes a toll on the body, not just for a football player, but those that are in fine and performing arts. So what benefits are there for our student athletes and our student performers?
Speaking of the athletes, I'd like to congratulate Egg Harbor Township boys for winning their first playoff game ever against Trenton. That's fabulous. Yes. So we have a lot of athletes that come in. The simple thing is that, and we were talking about it earlier, human beings only have sensory feeling to 8 to 12% of our body. It's somatic sensory. Mm-hmm. The other 88 to 92% we can't feel. So when a person has a misalignment, it's like me pinching your finger. You're irritated. But if I'm pinching your finger and you can't feel it, you're irritated, but you can't put a finger on it. So that could cause irritableness or anxiety. Okay. So what happens is when an athlete comes in, they're going to perform better when they're not irritated at all. Now, a lot of times they'll come in and it's maybe from playing basketball. They're threw out their low back or something to that effect. Mm-hmm. Well, when they come in, they lie down. I check their spine, and in checking their spine, the dorsal fins or the points on the back of the bone can go like this. So if they're in alignment and one comes out of alignment, I can feel that. I also can feel temperature. I also can feel muscle spasm. I also, when I'm probing on them, checking their spine for misalignments, I also can see their reaction. Okay. So when we adjust a student specifically for sports, not only are we putting that student back into a harmonic state for sports, but also they're going to retain more information in English class. When they go home, they're going to be more apt to focus on their homework rather than to go out for recreation. So not only will they perform better on the court, but they'll perform better in school and they'll perform better in home. And as we know, when you get into high school, there's a lot of different things. Our bodies are changing. Mm-hmm. You know, there's a lot of introduction to, the birds and the bees, so to speak, and alcohol and drugs and marijuana and stuff like that. So when a child or when a student is more relaxed, they make better decisions. And so we're really passionate about kids. Okay. I was a product growing up in Vineland, and they wanted to diagnose me with attention deficit hyperactive disorder. And it actually stemmed from a softball accident. I got hit in the face, and it wasn't until I was 17 years old where I received my first chiropractic adjustment, and then my life just started flourishing with I call it an endless vacation when you don't have stresses in your body.
Well, thank you very much for this wealth of information and also sharing that personal story now at the end as well to really just share in regards to where your passion came from. But you are definitely passionate and knowledgeable about this topic. Thank you very much for your participation.
My pleasure.
So we'll continue with more in regards to our health, wellness, and fitness series. Thank you very much.
Thank you, brother.
Yeah.
My pleasure.
Yeah.